Thank you very much. So, I got a quick presentation for you. I'm going to talk about two major themes. The first is, how do you stay a smart patient? And the second is, how do you stay a smart human being when it comes to your health? And I've organized it along those two ways. I'm just going to pick up another little complimentary line that you heard earlier. When I was a young surgeon, and I practiced just uptown Manhattan at New York Presbyterian Hospital, I was involved in creating the Complementary Medical Center. And the Complementary Medicine Center was all about giving people alternative approaches. So we had this really spry, elderly English teacher who was one of our patients. I had done a bypass operation on her. So she was in her room recovering, and all these complementary therapies were out there. We had massage and meditation, hypnosis, all these things that people can choose if they want, but they don't have to use them. She took every one of them. She took every one of those therapies. And at the end of the week, they're not free. You do have to pay for them. Someone from the center went in there and said, okay, well, here's the first ones are always free, but here's the bill. And she said, well, I don't understand. Dr. Ross said it was complimentary. We had spelled it wrong. So you better spell it right without the I. So let's talk about being a smart patient first, 'cause I think it's a smart place to focus on. And this is really all about you. And I say it's all about you, and all the books are called You. They don't have my picture on them, because it's not about me or any other doctor or healer. It's about what you can do to show up in your own life. And at the get-go, I'm going to make a point, an important one, which is that how you tell the message is often as important as the message that you're telling your friends and loved ones. And by the fact that you're watching me right now, you're part of the army of folks who are going to go out there and change the fabric of health in America. So it's got to be all about you. And if you focus on it in that way, on the show, we're always thinking, we're going into someone's home, they're often feeling forgotten, they don't have a voice, they're confused, they're scared, because they don't understand that so much of this is manageable. If we can be there for you and take this message to the people that you care for, then we can succeed together. So I was approached about 15 years ago by a bunch of folks who thought, you know what, the way that we're taking care of people in hospitals deals with the factual issues around their care. But people don't change what they do based on what they know. They change what they do based on how they feel. And so we began thinking very differently about how you give a message of wellness to a population. And we started writing these books, the U books, and we were approached by the Joint Commission, which, as you know, is responsible for helping this country decide what's worth doing and what quality looks like in the field of health. And they came to us and said, we've got a big problem. We've got all these people who want to improve the care of their patients, but they don't really know how to get the most important stakeholder involved. That's the patient. How do you get them engaged? So Mike Roizen and I started writing a book called You, the Smart Patient. And we wrote it with the Joint Commission. We were partners on this endeavor. And although this is really sort of a charity endeavor, we did it really just to get the word out there. This book ended up being on the New York Times bestseller list, which shocked everybody, because we never thought there was an audience for this kind of information, and began to realize there's a robust, really vociferous desire to have this content if it's presented the right way. Now, instead of going to people and saying, here's a laundry list of things to do to feel better, we made this a detective story. The illness was the crime scene, right? And you could go to that in looking for symptoms and clues, and all that, of course, began to make sense. The doctors were detectives. The hospital was the precinct. If you ask the right questions, you could get the right answers to help identify what was really wrong with you. Because we know that 90% of this discussion happens in between your ears. You already know the signs and symptoms. If someone can help you identify what they mean, you can jumpstart so many of these processes. So I'm going to give you a couple figures here that you all know. 40% of everybody who can hear my voice right now will have their life impacted by a medical error. The number of 100,000 is thrown out a lot for the number of people impacted on this. We frankly don't know how many lives are changed by medical errors, because it's so difficult to keep track of it, and so often it's underreported. But we do know, we estimate, that there's a medication error that occurs every single day that you're in a hospital. That's shocking. It's a lot of opportunity to improve care. And I frankly think it's part of the professionalism that we have to portray as physicians, because we're the group that has to be the ballast of the ship of society traveling in the troubled waters. And if we can help navigate those storms, which there are many today that feels troubled by this, then we can actually help society head in the right direction. So I think as healers, as nurses, physicians assistants, anyone in the health allied fields, we all have an obligation to speak out on these themes, which is why I'm here talking to you today. So how are you going to become a smart patient? I've divided into 6 major categories. I want you to understand a medical history. I want you to be smarter about picking Dr. Right, getting a second opinion, which, by the way, 1 in 10 people gets a second opinion. But if you get a second opinion, 1 in 3 times your diagnosis or your therapy will be changed. That's scary, I hope, for a lot of you. Shocking that you could actually change your diagnosis of your therapy 1 in 3 times just by getting someone else to look at your records and give a different opinion for you. Now, why don't we get second opinions? Most people say, well, it's just a minor procedure. I mean, what's a minor procedure? A minor procedure is a procedure on somebody else, right? If it's going to impact your life, it's not minor anymore. So whether it's a new medication or something small, seemingly anyway, go out and get second opinion, because it's patriotic to do that. When you get a second opinion, you're helping your doctor learn what another doctor thinks on your dime, on your time. You're helping those 2 folks talk to each other. And that means that every other patient that your doctor sees will benefit because you made that conversation happen. Because guess what? If their diagnosis of you is a little off target and you can help them with that, every other patient will benefit by getting the right diagnosis next time around. That's how we improve the system. That's why finding smart patients and endorsing this movement and making it happen in a robust way is so valuable to our nation. Finding the right advocates in the hospital, staying safe in that hospital, and of course, you gotta understand medications. And that is not a hard thing to do if you know what resources to use. So let's go back to the beginning. Understanding your personal history is fabulously easy to do. Most people don't do it. You gotta have a major checklist. What happened? When did it happen? You gotta understand your family history. Most people don't realize that a family history is a blood relative, right? It's not your grandmother twice removed because it's your wife's grandmother's sister. It's your personal blood relative grandmother who's got a medical problem. And the younger they are when they have that medical problem, the more likely it's genetically going to be a problem for you. So 85-year-olds who have strokes are not as important a clue to you as a 55-year-old with a stroke. And that's the way we sort of gradate this. Now, I'll tell you a quick story about how we often miss the boat on this. And I had a patient recently came into the office, and I was doing my medical intake, and I asked them, have you ever had a colonoscopy? The guy thought to himself, and he said, Dr. Oz, I don't remember. Take something the size of my thumb and you shove it up like, you remember that? I got to call Doris. I got to call my wife. I don't remember. I mean, it's a two-way street, right? We both have to be part of this. The word doctor means teacher, doctore. If a teacher is teaching you and you don't know anything about the topic, it's not going to be very beneficial for either of you. So when we go in to talk to our doctors, having a little bit of that gumption and the confidence, not to be aggressive but assertive and saying, I got a game plan here, I don't understand this, vitally important. Which is why I always tell people, write down your questions ahead of time, and here's the important part, make a copy for your doctor. Because guess what? We got through med school by studying hard. We know how to do our homework. If you give me homework, that piece of paper is my homework, I'm going to do it. I might organize your questions so it's a little more efficient for my time. I might do it a little differently than you maybe outlined it, but I'm going to get to your questions. It changes the focus and the locus of control in that conversation. So these are the basics of getting a general personal health profile. Picking Dr. Right. You got to ask people about medical specialists, and it's often not the doctors that know. The nurses know. Little tip for y'all. If you really want to understand who might be a good doctor for you, go to an emergency room or call one around 3 in the afternoon. It's the slowest time. All the people from the night have been cleared through. They went into the hospital where they're supposed to be. The doctors are still in their offices, so they're taking care of people still. They're not shifting them to the ER. So the ER is relatively quiet. The nurses in the ER see all the doctors, right? Because we all have patients coming through there. They know how we care for our patients. They know how our offices function. They have good insights about who's good and who's not so great at picking up on problems. So that's one of the ways that I always advise folks to get advice on these things. But even when you're in the hospital, you can do some checking. If you're visiting a friend who's not feeling well, while you're there, ask some questions about other doctors that might be available to take care of you, insightful about you. Learn a little about their partners. Are they qualified to take care of you if they're out of time? What do the other patients in the office look like? Right? If you're a 35-year-old triathlete with a knee injury and everyone else in there is a whole different generation, and they're dealing with very different issues, you want to know that, because it's a clue to you about what kind of a practice that you're engaged in. And finally, never talk to a doctor without another person with you who's your advocate or a tape recorder. You want one of those two things. And don't be intimidated by tape recorders. Doctors, well, they'll see them. You're going to say, listen, I brought this tape recorder because I want to understand everything you say and I want to listen to it again and learn it. And you know what we think? That's fabulous. Because doctors know, we're taught this early in our training, 50% of what we tell a patient during the office visit is forgotten by the time they leave the room, right? It's not even a week later. That day they'll forget 50%. So if you're talking to somebody and you know they're going to forget half of what you tell them before you leave the room, well, you're not going to pay attention to it all that much. You're going to rush through the conversation and get through it, which is exactly what we do. So having a tape recorder means that you're going to listen to me again. I'll take my time. I'll speak clearly, succinctly to the important topics. I'll address the questions that ought to be addressed, and you'll hold that information dear to you because you'll be able to revisit it. A friend will just ask questions that you might not have thought of. And when you're really nervous, sometimes you forget what to ask. That friend will keep you on board. Now, when it comes to tests, this is basically a logic tree. You don't have to be a specialist to understand the process of getting tests. What you have to be able to do is ask questions that are logical. If every single test, whether it's positive or negative, still will predict that you have to have surgery, why are you getting all the tests? The tests that are being ordered on you, that are going to be done on you, have to specifically be able to drive a decision about what to do with you, a decision about your diagnosis, for example. You got to figure out if there are alternatives that are less risky for you. How accurate are they? And that's partly answered by whether they're going to change your therapy. And of course, you need to be clear about the tests with regard to their complications and what they're going to translate to, whether it's positive or negative. Again, it's pure logic. You can be a computer programmer, a school teacher, a mother, and you can still do logic. If you can do a crossword puzzle, you can figure out if a test makes sense for you, and you can keep the system honest that way. And finally, prescription drugs. 1.5 million people seriously hurt every year with prescription drugs. For every dollar we spend on medications, it costs us $1 to fix the complications. That's Institute of Medicine data. Pretty clear cut. You want to use your pharmacist to keep you safe in this category. I think pharmacists are the most qualified, least used health resource in the system. They are legally responsible to you in the pharmacy to give you advice. They'll have a little private place to have a consultation with you. They can walk you down over-the-counter aisles. They know the medications and the complications with vitamins and drug-drug interactions. They know all that stuff. Yet we never ask them because we always assume they're out there behind the counter just passing pills out. Yet they know these answers if we're willing to take advantage of them, and they're proud to give that information. And remember, half the people who get medications, chronic medications, stop them within 6 months. So this is not just a matter of bashing people with data. It's about getting people to understand deep in their heart why this matters. It's not the knowledge that they need to have. It's the visceral awareness of why it matters that drives all of these changes in the healthcare system. And if you understand that at that visceral, deep, soul-felt level, you'll begin to change and transform your life. Whether you're hearing my voice now or you're talking to people that are dear to you in your lives, that's the message they need to hear from you. That's why it matters to them. Now, let's transition from being a smart patient to being a smart human being and doing the preventive things that make sure you don't have to be a part of the healthcare system. There are 5 life-adjusting events, 5 risk factors that we think control 70% of how you age. They are your blood pressure, which is the #1 cause of aging. When you have a high blood pressure, it shears off that delicate lining in your arteries, and when that blood vessel shears off, it's a major crisis for us. Because when that blood vessel is exposed, you've got to scar it down. So if I punch a hole in this wall back here, how do I fix that hole? I got to fix it with plaster. What's the body's plaster? It's cholesterol. I put that cholesterol covering over there, and if it's high quality cholesterol, you can't even tell I made a hole. But if it's cheap spackling, lousy, or LDL cholesterol, the oxidized, the kind you get when you get heavy, for example, that cheap spackling crumbles out, and that causes a problem as it falls apart. So these are the kinds of things we look for. But then again, what made the hole, right? The hole is made by high blood pressure. That high blood pressure is like a fire hydrant squirting away and scarring down that lining. That causes the rusting of our insides, which is what atherosclerosis primarily represents. Another thing that causes those holes are cigarettes and the nicotine and other toxins that are involved whenever you take a puff of a cigarette. But let me use cigarettes as a launching point for talking about interventions. Because I tell you, on the show, we spend a lot of time on this topic. As a heart surgeon, I long ago stopped telling people that cigarettes were bad for them because they already know. When you tell a cigarette smoker that cigarettes are bad for them, you're reminding them about how badly they feel about themselves. The fact that they couldn't stop on their own, even though they know it's not good for them. So I've told every patient that I've taken care of for the last 2 decades that as their surgeon, I'm going to refuse to operate on them until they stop smoking. Now that sounds really harsh, but it's really not. Because my one time to intervene is before I operate on them. And I tell them, listen, I'm doing this because I care about you. I could just as easily do your operation if you're still smoking. But I know you won't do as well, and I know you won't live as long if I do that. So I'm doing this because I love you. And that's the big message they have to hear. Because when you go to someone who's got a health crisis, a health problem, cigarettes are just an example of this, and you tell them, all I want you to do is to care about yourself as much as I care for you, that's the message that resonates to them. Now they begin to feel that they're worth it. And if you have that self-esteem, whether it's weight loss or cigarette smoking or other drugs or alcohol issues, any addictive behavior, and we are all flawed in some ways with our addictions, that message resonates much more than the finger-wagging doctrinaire where we sort of discipline you and lecture you, but don't really impact deep down the way you feel about the experience. So, cigarettes number 2. Number 3, daily exercise, got to be 30 minutes. But doesn't have to be a triathlete level of exercise. Just walking gets you there. But we need to have daily rigorous activity. It has driven longevity for all known human existence. And what kills us more than anything else is frailty. If I got rid of all of the cancer in America, you know how much longer we'd live? About 2.8 years. That's not what kills us. What kills us is frailty. We're so frail, we can't weather the storm of the diagnosis. We can't take the treatment that's required for it. And for that reason, we get culled from the herd. Number 4, a healthy diet that you love. Now, Georgia spoke to you about this, but it's not about eating healthy. It's about eating food you love that happens to be healthy. That's how you figure out a diet that works for you. That's how you provide a sustained, easy program. And people who lose weight always say it's easy when they finally figure it out because they've found foods that they adore that happen to be good for them. And number 5 is stress control. And I'm not going to talk you through stress control in great detail except to say it's not about getting away from stress. It's about understanding how to cope with it better. And deep breathing exercises, meditative experiences. Listen, everyone on my show is given transcendental meditation classes. They're offered to everybody, and they use them because it allows them to connect the dots that seem disparate and unrelated to create. That's what creativity is all about, freeing your mind to be in that moment. And when you can do that, you happen to get rid of stress as well. Because we strive to create. We crave that feeling of making a difference. And if we can't feel that way, then we'll begin to experience stress. And stress does lots of things for it, including this. Take a listen to this video. We tested all kinds of people.
Are you ready?
I guess.
From all different places.
Pennsylvania, California, North Carolina.
And all walks of life. Come on up.
I'm Bob Green.
Jared.
You're having your test done today,
Yes.
so...
I was supposed to have it done for a while because I drink a lot of water. I'm always thirsty. You can never cure the thirst.
37-year-old Jared had never been tested for diabetes before.
This is Jared.
Hey, Jared, how are you?
Good.
You know, when they call the doctor over, that's not good news.
While that runs, I'm going to tell you that number's supposed to be under 6. The amount of sugar that's traveling around in your blood cells needs to be under that number. That's what it should be for all of us. Your number is 12.8.
Wow.
12.8 worries me a lot. That's more than twice what's tolerable.
Yeah. That's what I do about it.
What do I do about it? It's the perfect question to ask. Here's a young man who said he was urinating a lot, he was thirsty all the time, and he was exhausted. What's the diagnosis? He has diabetes. His blood sugar level was 450. I sent him from the studio to the emergency room. He had no idea that he had a diagnosis that, in retrospect, is pretty obvious. But he is like a third of America who is diabetic or pre-diabetic, not recognizing that he's got pieces of broken glass, like little bits of shrapnel scraping that lining of the arteries that destroys those arteries in a way that's very different from the high blood pressure in the cigarettes that I mentioned earlier. And when we look at this problem, it behooves us to take a step back and figure out why didn't Jared understand this? Where did he miss the boat? Because if he didn't get the message, if America's not getting this message, I have to assume that I didn't give it to you the right way. Not just me, but all of us are not getting the message out the right way. So let me walk you through an example of what I told Jared and what I think can help for a lot of folks who want to lose weight, because it's the number one way we can get rid or significantly reduce the problems with diabetes and, by the way, hypertension and some of that cholesterol that I spoke of earlier. So Mike Roizen and I, Mike's the Chief Wellness Officer at the Cleveland Clinic, have written all these U-books. This happened to be called You on a Diet, but look at the red subtitle, the Owner's Manual for Waste Management. Right? It's not about your weight, it's about your waste. Conventional diets, they all depend on willpower, right? Willpower doesn't work. Biology will always trump willpower. How many of you, put your hands up, can hold your breath indefinitely underwater? Anybody? No. It's a dumb question. Of course you can't do it. It's biologically impossible. You have a dozen redundant systems to force you to eat. That's more than force you to breathe. You won't be able to force your body to go where it doesn't want to go. But if you understand the biology of blubber, you can nudge it in the right direction. And that, my friends, is how you get people who are chronically overweight or frankly suffering from any problem to head in the right direction effortlessly and go back towards their playing weight, which is their weight when they're in their early 20s. So let's walk us through this. The first issue, I mentioned it's waist, not weight. The number you're looking for is you want your waist size to be less than half your height. Right? So I'm 6'1". 6 times 12 is 72, plus 1, 73 inches. Divided in half, 36.5 inches. So if my waist size is under 36.5 inches, my chance of having diabetes, like Jared has, the high blood pressure, high cholesterol, it dramatically drops. But you got to actually measure it. You got to put the measuring tape at the belly button and put it over the waist. Because most guys, especially over the age of 40, they never buy a new belt. They just slide it down. Right? And they wander around like this. And they say, well, you know, I got a waist size of 26 down here, baby. Right? So these little tips are valuable because today, as soon as you hear this, you can measure your waist size. You can measure that of your spouse, of your kids. This number applies for everybody in the family. Doesn't matter how old you are, what gender you are. It's the same rule of thumb. Your height divided by 2 should always be a number greater than your waist size. But you got to actually measure it. That Texas belt phenomenon I just described is where a lot of folks get tripped up. Okay, so let me give you a couple of little concrete tips. Just to give you an idea of how you can sort of nudge that biology of blubber that I spoke of earlier. First example, you have something called an ileal brake. This is a valve, a part of the valve that sort of spasms down and closes down when you eat the right kinds of foods. High fiber slows the transit of that food, makes you feel full for longer by closing down that ileal brake. How many of you think breakfast is effective for weight loss? Put your hands up. Okay, do you think donuts count? Right? It's got to be the right kind of food. High protein, high fiber tends to be beneficial. That's why I always tell folks on the show, within an hour getting up, eat some fiber, some protein. It's got to be in your diet. And it's got to occur in a way that's sustainable. Don't reinvent the wheel. Automate it. Eat the same darn thing. And I'll come back to that theme. Second thing, you want to drop your ghrelin. That's that hormone that makes your stomach growl. Oh, it makes that sound when you get hungry. And the more you don't eat, the louder it gets. Those of you who've been on a diet know this. You can't beat that. It's designed to force you to eat. You are not going to be able to overwhelm that feeling. But you can trick it. An hour, half an hour before a meal, grab a handful of nuts, throw it in there, piece of fruit, whatever it might be. You want about 100 calories. And you will start to drop your ghrelin dramatically. Now, why is that important? Most of the time when you eat a meal, it takes about 30 minutes to drop that ghrelin back down to where it's making you at least feel comfortable. Well, in 30 minutes, you've eaten 3 meals, if you're like me, right? So you get up from the table and you just feel completely bloated. How did I eat so much? What went on? And now you understand why you're driven to do that. But if you have that snack a half hour before your meal, when you actually sit down, you're not famished. You can still eat more, but you're not famished. So you actually control with your head how much you eat. You're not driven by your gut to need to eat more. And finally, muscle versus fat. The problem with yo-yo dieting is when you go on a diet, you try to carve out more than 100 to 200 calories a day from your food, your body starts to, because it's smart, recognize that you're starving. It wants to help you and save you, so it shuts down the consumption of calories. As your metabolism slows down, you stop losing weight. So you're eating as small amount as a peacock would eat, and you're still not losing any weight. Then you get mad. But in the meantime, what's going on? Your body has begun to burn off some of that muscle. Muscle is a metabolic furnace. You have to have muscle mass to protect yourself. Without muscle mass, any little bit of food you eat will put weight on you. Women going through menopause feel this acutely because the ovaries don't just make estrogen, they make testosterone. And without testosterone, you start to run into a big problem because without testosterone, you don't get muscle built. So the same activities that used to keep you feeling a little bit lean go away. You get a little pooch through menopause, and then anything you eat puts weight on you because you don't have anything to function as that metabolic furnace. Guys, when you build that big waist up, the belly fat comes alive, and it starts to convert the testosterone made in your testicles. You know, your testicles are like little avocados, right? That's what the word avocado means, by the way. That word avocado in Aztec means testicles. They grow in pairs, one's lower than the other, right? And they have a little gritty feeling. That shape is familiar, right? So you want those those testicles functioning, but even if they're making the normal amount of testosterone, which you can, again, if you feel them, they feel normal, they probably are, your belly fat can burst out to estrogen. So you don't have testosterone in your body, you don't maintain muscle mass. And without that muscle mass, you will always fall behind. It's the first step I give people when they want to get on a program, because I'm giving you something, not taking something away. Before you go on a diet, build muscle mass. You'll be able to lose weight without even thinking about it, because you've got extra muscle on board. And for women in particular, it'll help keep you living longer because it avoids the frailty. The last tip about sleeping, about dieting, is to sleep. The brain craves 4 things. It craves food, water, sex, and sleep. All right, you guys will figure out the sex part on your own. If you're not sleeping, you will crave food and water, and you'll particularly crave carbohydrates. It's one of the first things to do when you put someone on a weight plan, is get them sleeping better. It's not easy to sleep well. 40% of the population has major issues with it, but sleep hygiene gets you there. So I made you a little toolkit. I have a lot of information on droz.com. We have a huge program in every one of the things I've talked about. They're all free and they're resources you can play with. United Healthcare has big programs in this as well. Take advantage of those resources. But just to whet your appetite, dimming the light before you go to bed allows your brain to start creating melatonin. Remember, what happened with our ancestors? The sun set, they saw the long rays. As those long rays hit their brain, our ancestors began to secrete melatonin. The melatonin makes us feel tired, and we fall asleep. That's why when you go out with your kids camping in the summertime, you'll begin to get tired before they get tired. But as soon as you're watching bright screens, that melatonin secretion is turned off. If you're going to take melatonin, by the way, take a very small dose, 0.5 milligram, maybe 1/5 of what's normally given in commercial products, and take it 2 hours before bedtime, so it has time to get into your brain. If you dose it the right way, it might actually work for you. So again, 2 hours before bedtime and a very small dose. Too much melatonin actually does the opposite. It'll stimulate you. You want loose clothing, you want an ambient noise level that's low, or something that you prefer like waves, or get one of the sound machines to create that for you. You want the room to be as cold as possible. If your baseline sleep temperature is 68 degrees. And if you don't sleep well, you can get down to 62 degrees and put socks on, because socks will warm your feet, which allows your body to get cooler. You want your core temperature to drop and you will sleep better. And then you will surrender to sleep, because you can't beat sleep. You can only surrender to it. Now, driving down here, I was at the hospital operating today. So I was in traffic and I was late to come down here, and someone cut me off. And it makes you upset when that happens. Getting angry at that person, that's a normal human response. Wishing they would die, that's different, right? So you have to differentiate anger from hostility. If you don't feel like you're a raindrop falling into the ocean of humanity, you're isolated. You're feeling separate from everybody else. That's what breeds the kinds of ailments that we talk about, the separateness that afflicts our society so profoundly. If I give one diagnosis, overarching diagnosis, that might not just deal with our medical, but maybe some of our financial ailments, is we feel that we're living in an environment where we can't trust each other. We feel separate from each other. Perceived stress, getting back to that risk factor I discussed earlier, is what counts, not the stress you're actually under. And when you perceive stress, you need those social networks to support you through that. If you have bankruptcy in your life or a threat of financial collapse, it will age you 7 years. That's real age data. And if your real age, your physiologic age, how old you think you are or your body thinks you are, gets older, the only way to reduce that effect of financial stress is to provide that social network beneath you. That's why these issues are so important. And telling someone who's angry just to calm down, that's the worst thing to say, right? Because anger doesn't call for calmness. Anger calls for action. Like depression calls for action. That's why I'd rather not over-treat those things or talk to them, but just I recognize these are opportunities for us to grow and get better. So then let me leave you with 2 last images. First off, I want you to think about the reality that when you're driving in that car of life and you miss your turn, does the GPS berate you? No. It says at the next available moment, make an authorized U-turn. What is the big deal? Don't be a schmuck. Right? It's not a big problem. Get past yourself. The ability to forgive yourself, to make mistakes, is important for any program you're on in your life, because we're all mess-ups. At our very core, we're all full of lots of problems. That's what makes doing the show so much fun for me, because I get to look at people who have a lot of issues, like I have, and try to work them out together. All of us have the opportunity, if we learn to make U-turns, to get back on track, learn from those mistakes. And remember that smart dieting, smart living is not a wind sprint, it's a marathon. And the secret, my friends, is automation. If you automate what you're doing, if you eat the same breakfast every day, have those same nuts in your pocket for a snack in the mid-morning, have the same kind of mid-afternoon tea to get you going, you'll automate those easy things so that the hard decisions, which have to take place in your life, sometimes won't tax you out. And if you do that wisely, then you'll recognize the most important lesson of all, which is that your heart, my friends, needs a reason to keep beating, which is the whole reason I was proud to come and talk to you, because you are the ones who make that true for those in your life who you care for. So thank you very much. Bless you.